Medical things they don't tell you about, part 43. In 2023, a gene therapy was developed for sickle cell anemia. In short, sickle cell anemia is when your blood is not the ovaloid shape that it should be, but it's more of like a sickle or a crescent shape, and that's the type of blood shape that gets stuck in different body parts. It might get stuck in your brain and cause a stroke, and the heart might cause a heart attack, and so on. These patients, unfortunately, will come to the hospital in a lot of pain because sometimes the blood vessels are sickling in like the hip, and could be in the knees, could be in the shoulders, could be in the chest, and so on. So what's interesting is that the genetic editing was using a form of technology where you take the actual stem cell of the patient into a lab, you edit the stem cell so that you remove the faulty gene, and then you insert a gene that produces normal hemoglobin. Then you re-inject that into the patient. And actually, it involves chemotherapy to kind of clear out some of the stem cells that the patient had so that you can make room for the newly edited stem cells. Actually, in one study, it showed that 2 out of 47 patients ended up with some form of secondary malignancy after getting the gene therapy. And the conversation is more along the lines of, well, did the gene therapy cause this, or was it maybe the chemo was too strong and caused the cells to break down and then lead to a secondary cancer? 2 out of 47 is not the end of the world in terms of people who had a really bad side effect, but it's just something to consider that with newer technology, you might not see the downstream effects for 5 to 10 years. So if someone's really high risk sickle cell and they need it because they could die from a stroke in a year, well, if you could buy them 10 years with gene therapy and then worry about a more serious side effects, then that could very well be the way that you go with this.